This is Selma Schimmel in Chicago for the group room. We're at the 2012 Multidisciplinary Symposium in Thoracic Oncology, which is brought to you by ASTRO, IASLC, ASCO, and the University of Chicago. And I'm so happy to be joined by Dr. Joan Schiller, Chief of Hematology and Oncology at the University of Texas Southwestern Medical Center in Dallas. You're also the president of the National Lung Cancer Partnership.
I am, thank you.
Where are we today in our understanding of women and lung cancer, the gender component?
So there are some differences between men and women in how they either get cancer, lung cancer, or how it should be treated. And one of the things we have learned over the past decade or so is that women can metabolize the cancer-causing substances in cigarette smoke, called carcinogens, differently, causing them to build up, basically, so that they hang around a little bit longer than they do in men. The other major thing I think that we are learning more and more about is that estrogen probably really does play a factor. And we are learning more and more that even though if you are on a estrogen supplement of some type, it doesn't actually increase the chances of you getting lung cancer. But what it does do is, if you get lung cancer while you happen to be on one of those pills, you're likely to do a little bit worse. That estrogens can drive lung cancer just like other types of mutations can. And just like estrogen can drive breast cancer, for example.
Do we understand the role that estrogen actually would play in lung cancer?
Just like in breast cancer, it causes a cascade, once again, of chemical reactions within the cell, which wind up in the nucleus and cause those cells to grow and divide faster and faster.
So in men, the male hormones have no impact, only the female hormones on the women?
The way estrogen works is that it doesn't dissolve directly into a cell, but instead it attaches to a receptor on the outside of the cell, the estrogen receptor. And it turns out that cancer cells in both men and women can have a type of estrogen receptor called estrogen receptor beta. And men can have this ER beta as well. But women, on the other hand, have more estrogen circulating around. So that might be one reason that causes them to be more likely to get lung cancer.
What can we do amongst the advocate community to raise the level of understanding, to empower women to overpower lack of receptiveness? What do we have to do as an advocate community?
I think we have to challenge our physicians. And we have to challenge them to make sure that they know all the treatments out there, that they know about all the mutation studies that we're learning about, and that they don't just accept lung cancer is a death sentence. That there are treatments available, people can live longer and better than they ever could before, and we're not going to be satisfied with anything less.
Thank you, Dr. Joan Schiller, Chief of Hematology and Oncology at the University of Texas Southwestern Medical Center in Dallas and President of the National Lung Cancer Partnership.
And thank you very much. Thank you, Selma.